Hi, I'm Chris Ketzley, Executive Director here at the Association of Towns. Talk of the Towns podcast is a production of the New York State Association of Towns and strives to bring the voices from across New York to talk about all things towns. If you're interested in participating as a guest, please email us at info@nytowns.org. The views and opinions expressed by podcast guests are of their own and do not necessarily reflect the views, positions, or policies of the New York State Association of Towns. Welcome back to another edition of Talk of the Towns, where we talk about all things important to towns. Another great episode for you here today. We're going to be talking about something very important to your employees, very important to society in general. We have a great guest with us. But as usual, before we get to that, I just want to remind you that if you find us on YouTube, you can find us on Apple, you can find us on Spotify. However you listen or watch, please make sure you hit like, share, and subscribe. That helps us with our rankings. Like, share, and subscribe. We have a great show here for you today, like I had mentioned to you, and it's going to be something I think you're going to find very interesting and very timely, and that's really a discussion on the needs of your employees from a mental health wellness perspective. And we have with us Adam Howell. He's with us here today. Hello, Adam. Adam has two roles, really. Number one, you're an outreach director for New York FarmNet at Cornell. And then two, you're a graduate student and you're working on putting together a research project in relation to how to help frontline public service workers really get the mental health services they need and help them deal with some of these stresses that we see today. So welcome, Adam.
Thank you. Thanks so much for having me. I really appreciate it.
Why don't we start real quick? Just a shout out to New York FarmNet. What does New York FarmNet do?
Absolutely. Thanks so much. New York FarmNet is a free in-person and confidential consultation program for any farmer in New York State. So any commodity, any size, any type, from Long Island to Western New York FarmNet provides two types of support, actually. And it's a very unique program. FarmNet provides financial analysis and consultation, so farm business management, retirement, succession planning, all of these financial or business aspects for anybody who calls. And then also we deploy social workers. And what we've found over the years is that the social workers are a critical element because for farming, as with many jobs, the social, behavioral, and mental health element can't be easily separated from the financial and business elements. So especially when it comes to the cultural aspects of farming, it's very intertwined with their lives and with their hopes and their dreams and their identity. So the social workers provide not therapy directly, but they do provide a setting for people to learn how to better communicate. There's a lot of times often family conflict. They provide ways for people to manage stress, for people to look at things like intergenerational conflict. Sometimes the elder generation has a totally different idea about how the farm should be run than the successor generation. So working together, those are two elements that come together to create a holistic plan and a holistic consultation strategy that has given us so much success. And FarmNet's been around for 40 years, so this is our 40th anniversary. We were started in 1986 whenever the farm crisis of the 80s was really hitting not just New York, but the entire country. So it's a program that's born out of experience.
Yeah. It's a great program. And for many of our members, they obviously, farms are the backbone of many of our towns. And so for many of you folks listening, I know you know farmers out there. There's a great resource for many of the farmers across the state, New York FarmNet at Cornell University, correct?
Yes, absolutely.
But you also have another initiative that you're on, you're a graduate student, and you are putting together this research project we talked about. So why don't we take just a moment to talk about really what inspired you to start this research project, and then we can get into that.
No, absolutely. It's this is a project that was born out of some inspiration from FarmNet, which is a model that I've seen firsthand work for so many people. And then my background is in public service. I come from a government background, and I've worked in and around government or government supporting programs my entire life, and especially at the local government level. So many of my friends, many of my acquaintances, both professionally and personally, are in public service. And I have noticed in the past, but even more so now, that there's a lot of human suffering out there. There is more stress. there are more constraints, there's more pressure, and unfortunately, it's building on especially the frontline public servants. So the people that deal with the public, the people that are in elected roles who have to answer to the public. There's a lot of pressure out there, a lot of rising incivility, and many other things. So my inspiration was, how could we take this great FarmNet model and maybe apply it to public servants? Because we know that there isn't a lot of budgetary flexibility. There isn't a lot of resource available for things that can be institutionalized within an organization like a town or a county government. It's very difficult to hire an on-staff social worker or therapist. So one of the ways I was thinking was maybe we could create some training or introduce some training and education to these frontline public servants so that it can start to build some resiliency. And with this May being Mental Health Awareness Month, I think it's a great time to talk about it because there are misconceptions about mental health, there's stigma out there, and outside of emergency services, I think people don't consider enough how the rest of the public service population or ecosystem, however you want to talk about it, also take on a lot of stress and also have a lot of pressure, and there's a lot of burnout. So that's what I'm working on right now through my research.
It's great that you recognize that because we know that. And so this is going to be, I think, very valuable research when you're done. You hit on a few of the issues, and we'll get into the incivility probably later in the podcast because that's a whole subject that we can explore. But what would you say are some of the pressures that can impact local government employees and local governments in general?
Absolutely. Well, definitely resource constraints, which lead to declines in the overall workforce. As we know, when it comes to local government especially, the work can't stop. You know, these are critical foundational roles for communities across the state, whether it's, public works or police and fire. And we know that, especially outside of New York City, there's been a decline in the overall workforce across New York State. And this is a trend that's all across the country. So that means fewer people doing the same work. That's one level of stress. The other thing is we've seen I think we're over $15 billion of federal support that has diminished in one way or another, either directly through a pulling back of grants or through federal services like rural hospitals, Medicaid support, things like that. So all of that actually puts more strain on the people and local government because they have to pick up the slack in those areas too. And then just, and I know we'll probably speak more about this, but the general tone and tenor of the climate right now, let's say the political climate and the kinds of stress that are out there in the public space, internet, social media, all of these things are combining to create sort of a climate of incivility. We know that these problems are rising, and there's nothing on the horizon that says they're going to start to diminish anytime soon. So people need to understand that creates a heavy emotional burden on public servants, and we see it in recruitment and retention issues. It's harder to fill roles. It's harder to find people even to run for office, and mental health is a big part of that, in my opinion.
Do you feel there's still this COVID burnout component still after all these years?
I definitely do. And I think that there's a couple things. First of all, there's plenty of research and statistics on how COVID initially impacted the workforce. We saw dramatic declines, health in the healthcare sector, especially a lot of people burned out. So we still have not bounced back from that area, thanks to COVID. But also, I think it changed the model for how people do their jobs, which has unintended consequences. Remote work or constantly being shifting towards online work, that takes a social emotional toll. And I don't want to forecast that I am an expert in like these sorts of issues, but there is good public research that shows that just the way work has changed thanks to COVID has caused elevated levels of stress, burnout, isolation is another thing, especially in rural areas. That's where people really see a lot of pressure coming about.
That's fascinating. And we'll probably maybe explore that a little bit too. But I read somewhere, I think in the summary of your research and whatnot, but you note unfunded mandates as a source of stress. That's interesting to me because unfunded mandates from the state down onto local governments, we know that creates a fiscal stress, no doubt about it. But I've often talked about the fact that there's more than fiscal stress there. There's what you've uncovered.
Absolutely. I think, my past experience working in government, I've seen the impacts of what unfunded mandates do, not just from, like you said, a financial aspect, but also when it comes to a mandate or when it comes to the roles that local government has to play, they can't just not do it. So a lot of times this leaves a limited staff and a limited amount of capacity to handle greater and greater work burdens. And there's a human cost to that. It's not just a balance sheet thing. People from the elected officials all the way down to frontline clerks and people working in the front offices will have to deal one way or another with either a reduction in service quality or the somehow ability to figure out how to do more with less, unfortunately. So those definitely have a serious behavioral and mental health aspect to them that I think a lot of people don't realize.
Yeah. And I think we've talked about this off camera. I think public employees are more susceptible to burnout than other industries, it seems. And I don't know why that is.
There has been a lot of research and surveying that has uncovered that it is a reality. Burnout is much higher in the public sector, especially when it comes to areas of lower resources, local governments, rural areas, and things like that. I think some of the reasons we've discussed here, and some of it has to do with more research is needed, and that's really one of the things that I'm trying to uncover, because it's not just a lack of support, and a lot of people they find in this research are actually bolstered by their desire to serve the public. People do public service not just for a job, but it's a passion. They want to serve their community. That can help build resilience itself. But, if there is conflict or if there's incivility on top of the stress burdens, that takes away that you get compassion fatigue, essentially. And that takes away some of that desire for public service, and you get a pullback of helping behavior. There's a researcher out of Harvard, Dr. Elizabeth Linos, who has done a lot of foundational work on this subject, where she's found the ebbs and flows of what can help bolster public employees and what actually harms their ability to continue doing the job. So,
very interesting. Mm-hmm. Let's turn now to incivility.
Yes.
One of my favorite subjects, because it is such a growing topic of discussion, and it's affecting the workforce. It's affecting, I think, the desire for people to run for local office. And I'll tell you, I tell the story all the time. I started running for local office 20 years ago, if not longer. And by the time I was done with my tenure serving in local capacity, I noticed a very marked difference in incivility to what it was when I first started. And I think there's a lot of reasons for it. We can talk about a bunch of them. I think we hit on potentially the work from home phenomena has really kind of like isolated people. They're not as social as they used to be. Social media, clearly, I don't even want to get into how ugly that's gotten for local officials. But I think there's other factors at play too, and I think one of them is politics has gotten so divisive, and it's trickled down. Used to be local government, people didn't really care as much about your party, but now I used to go door to door and get the question, "What are you? What one are they?" And then if you answered right, we're with you. Yeah. They don't know anything about me. Or if you answered wrong, they're like, "We're not voting." They just shut the door in your face. What do you see in that whole arena? You say it's not getting better, and I agree with that, and probably no indication it is. But what are you seeing as far as what's driving this mostly?
Yeah, I think it is and again, I don't think it's one party or another, but it is a top-down, unfortunate sort of driven by leadership at higher levels. We're seeing people that are more okay with expressing themselves in ways that even just a few years ago would have been outlandishly inappropriate. And then you've got the social media and internet aspect, which introduces either an anonymity or a departure from accountability to the way people can now speak to one another. You know, they're removed from the consequences of what they say, how they say it, even threats and so forth. So there's less accountability. There are more examples that, you know, human beings see other people doing things and they will do it themselves. It's just the nature of humans. And again, it's not a partisan thing. We're seeing it all over the place. And then the other thing is, I think, when it comes to incivility, is that you're seeing that there's not a lot of institutional strategizing on how to respond to it by various levels of government. In fact, there was one survey I mentioned in some of my research reviews that talk about how something like 70 some odd percent of elected officials have been threatened or received some sort of threat or harassment, but I can't remember the exact percentage, but very, very few had any type of institutional strategy, response, or some sort of structure on how to deal with that. They're kind of left to their own devices, you know, and of course, you know, local government especially, we depend on people who want to serve just because they want to serve the public. They want to be a part of their community. They want to give back. You know, the rewards aren't going to be, you know, beyond that. You know, it's got to be your own desire. And when it becomes threatening to yourself or your family, and there's no way to deal with it, you don't have the tools or resources, you know, personally or institutionally, people pull back from that. And like you said, there have been so many cases where it's becoming hard to find even enough people to run for office to keep, you know, local boards, commissions, and things like that going. It's hard to find frontline staff to fill these roles, and the public will start to notice that. And the other thing is, the sad thing is, it's a vicious cycle, right? Because if services decline or leadership isn't there, or people are the kinds of people that are running for office are there for maybe not the noblest of reasons, it's going to filter out into the public, and it's going to be a feedback loop. So, yeah.
It's a tough time that we're in, yes. I guess. And so we have all these pressures we talked about on these folks. How does this really manifest itself for not just the individual, but also the communities? Like, what are the impacts on the communities and the individuals?
Well, one of the impacts that you'll see is a lot of times, especially in areas where there aren't enough clinical resources, so therapists, treatment facilities, and things like that, local governments and local frontline public servants, they tend to be the default people who receive those individuals who are experiencing some sort of crisis or some sort of mental distress, because they'll look for any official anything, whether it's a, you know, code enforcement or whether it's a clerk or something like that. So when it comes to the capacity that isn't there in the mental health space to deal with people who are suffering, local governments become de facto having to deal with it in some way, shape, or form. On the local government workforce, you see major expenses in terms of recruitment, retention, and turnover. And people don't realize that when somebody leaves a position, not only do they take with them institutional knowledge and experience, but there's a real cost. You know, you have to recruit, you have to train. I've seen varying numbers, but 100 to 150% of salary sometimes can be the cost of high turnover in these positions. So there's a human cost, there's a financial cost, there's structural impacts, service quality. When people pull back and have compassion fatigue, they're not going to be willing to go the extra mile as much. They're not going to be willing to show up in the same way that they once did. So we really see detriments all across the board.
You've mentioned before, I believe, that depression, anxiety, stress lead to lost productivity as well,
Yes,
sick time.
absolutely.
Right? And I think they can attribute, some study I saw can contribute or attribute 12 billion, I think the number was, lost work days to this.
Incredible.
Yeah.
The World Health Organization, they're one of the biggest groups that have studied this, not just nationally, but internationally. And you said it, I mean, billions of working days lost. And it's a different type of loss too, because sometimes it's not just an increase in physical illness or things like that, but it's unplanned sick days or unplanned absences. You know, people become, that's like the essence of burnout. You become overwhelmed to the point to where you can't get out of bed, you can't show up. And, you know, when it comes to critical roles, unplanned absences can be terrible. But the federal government has identified, there have been several studies by HRSA and others that have identified the fiscal and working day impacts of mental health and distress. Again, it gets into the hundreds of thousands to millions. And the good news is that these big organizations and these big studies, they're starting to show that people need to treat workforce mental health and behavioral health as a core support pillar for the organization. It's not something that is additive or something that's a benefit that is, it's every bit as important as retirement or as, you know, health leave or things like that, because it has serious impacts on an organization's ability to continuously provide service. If people are burning out, they're leaving. They're gone.
And they get more jaded.
Yep.
Probably less sensitive to
Absolutely.
better service to the public, because it's one of these things, and it's awful. You know, I've seen in reports that there are estimates that 8 in 10 surveyed for local officials have experienced some form of harassment, threat, or violence. What's interesting is fewer than half work in the office with a strategy that can handle these incidents. So half of these folks don't have any strategies to deal with the stress. I mean, first of all, 80% is a big number. And then you have 40% of those folks don't have a way to handle it. So what is community-based training and education for mental health?
Absolutely. So community-based mental health training and education is one of the most accessible ways that, you know, as we talked about, cash-strapped organizations or areas where there are not enough clinical service providers can do something to help raise the bar for their staff and for the public in terms of mental and behavioral health. And what I'm talking about are evidence-based training and education programs that have been around for years, that they have proven positive outcomes for the people who engage with them. Mental health first aid is one of the most prevalent and common forms of community-based training and education. It's basically under the concept that mental health first aid can be trained, people can be trained in mental health first aid in the same way they can be trained in regular first aid. You know, you don't have to be a brain surgeon or, you know, a cardiac specialist to know how to clean a wound and apply a bandage. CPR, anybody can do that. There are elements of mental health, even when people are in crisis, that can be taught to everyday frontline individuals to recognize certain signs of distress, know how to engage those people, know how to talk with them about it, know how to recognize things in yourself, and then see if there's a need for a referral to a clinician or something like that. Supervisors can be trained in this so that they can recognize, you know, staff don't always unload their problems right away to or the pressures that they're seeing to their supervisors. So mental health first aid is a big one. There are other versions out there. One is called QPR, which is question, persuade, refer. There are suicide prevention types of trainings. One is called Talk Saves Lives. And then there's more baseline ones like stress management, just strategies and methodologies for managing your own stress or recognizing it in others. The other one that I think is really important type of training which is related but not exactly fully mental health is de-escalation. We teach first responders de-escalation, and we teach a lot of times people in the medical professions, especially in emergency medicine, de-escalation. But I personally feel that it should be one of the core training things that any frontline public servant is knowledgeable about and trained in, because people don't hold it together or decide to be polite just to certain types of jobs. They will express themselves to anybody of any type, anywhere, in any role. So yeah, de-escalation I think is a big one.
I think that's a critical
Yeah.
point you've made. You're not really suggesting that these towns have to invest in any new people or programs. They're folks that can be trained already on staff, is like
Yes.
having a chief mental health wellness officer type of thing in my head is how I'm thinking about it.
Yeah, mental health first aid, there are thankfully thousands of people out there who are trained to provide the training. So it's meant to be accessible almost anywhere. You can do it online, or they have in-person versions or hybrid. And then once somebody is certified, has been through that training and is certified, they are then more qualified and more literate and have more capacity to recognize these things within an organization, because there are lots of things that can be done that don't have to involve a high amount of cost. Sometimes it could be as simple as maybe rotating out somebody from a public-facing role into to just give them a break. It can be as simple as dusting off and opening up an employee action plan and seeing if there are other things that can be done to make it more specialized and more effective for the people who go through it. Peer support programs, things like that are all very effective, but none of this requires the municipality or the unit or the organization to hire a specialized clinician, social worker, or practitioner. This is meant to be trained by community members for community members. So very accessible. That's one of the key frames of my research.
So I'm going to ask you about these EAP programs, which a lot of towns have.
Yep.
And, I always thought about it from maybe some of what you're talking about can be handled through an EAP,
Right.
But I also feel like sometimes it's put in place conveniently to just give a phone number to someone and then they think you did your job. You check the box, here's an EAP number, give them a call if you need them.
Yes.
How do you feel about the EAP program, and does that help? Can that play a role here?
Yeah, I think it can. EAP programs, they are as robust or as light as the organizations want them to be, right? And like you said, sometimes it's a dusty file folder and a checked box at the end of the day, and they really can be so much more than that. There are actual professionals out there who are trained in how to review those programs and develop them into something that's much more robust. And also, I think that there are plenty of ways that organizations, whether we're talking about a municipality or a nonprofit or anyone, can look at their whole operations and then look at that EAP program and see how can they adapt it. Every location, municipality, area of the state, culturally, demographically, economically, there's so many differences. You can't have a cookie cutter response to any type of employee wellness initiatives or behavioral support systems. You have to look at what works in your community, your culture, your region, and then you have to customize it. And that's why I look at this as like, these are all different tools in a toolkit. What works in New York City or what works in a very large urban region is going to be completely different than Cuba, New York, or something like that. So I think people really need to understand that the adaptation of these programs and these tools is critical based on local needs.
So a sensitive area, maybe get your thoughts on this, is for a person in a position of authority, say a supervisor or department head, approaching somebody and maybe starting the conversation, and they may feel very uncomfortable because they're kind of getting into a territory that's a little bit, hey, are you okay?
Yep.
Type of thing. How would you suggest they may start those conversations.
Yeah, it's interesting because we also see this. I'm thinking of FarmNet now a little bit because whether it's formal or informal, especially with small groups, people in positions of authority, it can be difficult to be the boss and be the sort of informal counselor. So one of the things that we look at is or that I've seen is taking a look at who are in what roles and how can those roles work best to help somebody who's struggling. What I mean by that is it may be better to initialize a peer support program to where a person or somebody at work is talking to a peer as much as anything else, because they're not going to be as likely to open up to a direct supervisor. People still have fears of jobs and things like that. But I do think that there's still a very important role that supervisors can play by engaging somebody who appears to be struggling. Obviously, you want to make sure that you are doing it in a way that legally and human resources wise is appropriate. So seek guidance where you need to. But at the end of the day, the supervisor is the one who can take somebody out of the front line and maybe, give them a break or help manage their workload, things like that. So they do have a role to play. I think that it's just recognizing and getting some training and then understanding what is appropriate for you as somebody who is an authority figure.
Yep.
To find that right balance.
Yep. And I think my piece of advice for a lot of the supervisors out there and whatnot, when I was in town hall for 15 years as a supervisor, my office was right in the center where people come in and they had the glass and everybody's like, oh, you should close the shade so nobody can see you. And then I'm like, no, I want people to see me and I want to see people. I'm a very social person, by the way. I never would want to work from home. I'm not a work from home person. But really one of the benefits of that was when I used to notice a clerk or frontline worker getting just harangued by someone in the public, I would come out and step in between and I would tell the person, the employee, you don't have to take this abuse, please let me handle this. And I would take the abuse. But I think leadership, that's what's important. Step in and protect those people when you see it happening. And so I think the advice in that is be aware.
Yeah.
Be aware of what's going on in your employees day to day and when they're in trouble.
And you mentioned it right there, leading by example. I think if the community of staff see leaders at the highest level showing that level of support and empathy and backing their staff, then others in different roles will feel more comfortable about it. It will create a climate that's more conducive to better mental health. So I think leadership, that's one of the most powerful things that can be done is, lead by example and show that support so that other people can see it.
You mentioned, I wanted to go back because you mentioned something about, what's good in New York is not good in Cuba, New York, and that kind of stuff. But there are a large part of the U.S. population, but also population within our state that live in these mental health professional shortage areas, right? They're identified. 16 rural counties in New York State have a shortage, according to the Comptroller's office here in the state of New York. So it's difficult for some of these folks, particularly rural areas, of accessing this type of care that just isn't available.
Absolutely. I mean, there have been some innovations that have come about, telehealth and things like that. But we know that there's limitations, especially from a therapeutic standpoint, how for things like telehealth and whatnot. But rural communities more and more are finding themselves without adequate access to providers of any kind, whether we're talking about therapists, whether we're talking about clinical facilities, prescribers, social workers. And that gap makes community-based trainings, destigmatization of mental health as something to talk about, which is a problem in rural areas, and just mental health literacy so much more important because as people from rural areas know, many times you're on your own. Whether it's a natural disaster or something fiscally or anything of that nature, the people living there are the ones that have to deal with everything first because there's no cavalry that's going to, parachute in and fix it all. So Having that training available, especially in rural areas, and starting with organizations that serve the public, that's one of the best ways, in my opinion, that we can at least start to build a more resilient system out there in the absence of formal support systems.
Because it could be a double-edged sword out, when you live out in the rural areas and you're kind of alone. Some people find it peaceful and solace, but some people end up getting isolated. So it's one of those kind of things you just have to be aware of.
It depends on like you said, who you are and what is going on in your life. That isolation can be a trap. It can be a blessing, and then something bad can go on in your life, and it can be a curse because you've got no one to talk to.
That's right. So you've talked a little bit about some examples of this frontline, first-line support, community-based training, mental health, first aid, and de-escalated training, stress management training. How do these programs, it's self-evident how they'll help employees in particular, but how do they help also local governments? If they were to employ these strategies, how would it be beneficial?
Well, I think, number one, that from the local government level, and I'm thinking of like the whole system of governance, you'll see much better retention. You'll see much better abilities to recruit because it goes at the heart of what drives people to public service. The joy of the job, so to speak. You'll find that because of these trained individuals, that effectiveness will go up, literacy about these topics, because like I said, people in local government will see people in their communities suffering and not have any clue what to do. So it's not just for the organizations internally, they'll become better public servants. And then finally, I think that there's going to be a lot more capacity to focus on other things whenever at least you have some element of support in terms of a mental health system in place, whether it's training and education, so you don't have to, so you can put the other resources in other places. This is meant to be cost effective, I guess, is what I'm getting at.
Right. I think it's less costly than having to try to recruit people with higher wages, and all that is kind of papering over the situation. Okay, you're getting compensated more, but you're still being abused, And so it's one of those things that I think this can actually solve the root of the problem instead of trying to treat some of the symptoms.
I think about it all the time. People that work in finance or tech or something, they may just make loads of money, but that doesn't help their emotional or social wellness and their own internal, money and material support can only go so far if you are in a really bad situation or a really bad job role or something along those lines. So, yeah.
So, we've talked about a lot of things, but when you think about some of the low-cost options that local governments can look at to ease the pressure on their staff, what were if you had to give 3 top or 4, whatever, what do you think they are?
I think mental health first aid is a program that I can't say enough good things about. They have a limitation on the number of people per class. It's usually about 30, and for a few $1,000s, and we're not talking tens of thousands or anything like that, but usually it's about somewhere between $90 and $120 per seat. They get an 8-hour training course and a lot of supportive material to go along with it, and there is a ton of evidence that shows it's a really effective program in bolstering outcomes, awareness, literacy about mental health, things like that. I think peer support programs where it's practical are great as well. Those are essentially, other than some time, those are a very low cost option for peers to show support to one another. And the researcher at Harvard, Elizabeth Linos, that I mentioned, she has done quite a bit of research showing that peer supports and inclusion can actually have a dramatic effect on the overall well-being of employees as a whole. So that's a good one. Taking a look at that EAP program. It doesn't have to be a super deep dive. There's a lot of great information on the internet. There's a lot of great information that's for free out there about different HR policies and things like that. But just taking a look at it and seeing where the gaps are, maybe contacting or bringing in your employees for feedback before there's a crisis, and getting what are your needs, what could be done better. Awareness and action and interest in making the work environment better for employees is a critical thing as well. So those are a few, and then the last one I'll plug is de-escalation training. I think that I really truly do think that almost every public servant that works with the public or is an elected official should consider de-escalation training, because like we said, these issues aren't going to decline anytime soon, especially when it comes to harassment, threats of violence, incivility. So
I agree with you 100%. and I think the message I'm hearing, and I think someone used to sign off their show all the time with this type of messages, we just have to be kind, right, to each other. We have to be more patient. We have to just understand that we all have bad days, and we just have to kind of like be kind to each other. And I hate to sound so simplistic, but I think there is some simplicity in this to try to de-escalate the incivility. I'll tell you a quick story. I find it funny. I still, I'm getting older in life. We all are, but I'm getting up there. And, I was having dinner with a friend and who, said to me, do you feel like as you're getting older, you're just getting crankier and you don't care and you say whatever you want to people now? And I'm like, no, the opposite.
Yeah, I feel the
I've
opposite.
come calmer. I've come more patient.
Yeah.
What you have to say doesn't bother me as much. I'm just here to listen and, not going to engage in arguments. And I think everyone has to I think it might start with just finding that inner calmness, first of all. Center yourself, and very little can get to you.
Sure.
If that's the case, and then you can be kinder to others as well. So as you age, don't get cranky. Don't do it. It's very easy to do. But I do find myself much less irritated than I used to be. So that's good. So Adam, we talked about a lot. Is there anything that you want to add that we haven't touched on?
No, I just want to say that, this research that I'm doing is coming out soon in the form of a survey. I would love it if anybody in the public sector space, especially local government, that'd be interested in taking this. It's completely anonymous. We do not identify or even make it possible to identify the people who are responding to this survey. There'll be an article and a link in the next Talk of Towns coming up, but I'm also going to be putting it out to anyone in the local government or local nonprofit space who is interested in these topics. We want to learn as much as possible so that we can design a model that fits this sector specifically. What the needs, constraints, and possibilities there are for local community service. So my email is ah959@cornell.edu. Please, anybody can contact me anytime if they would like to take the survey, distribute it, or just talk about this. I love to talk about it. I think it's important, and I think that public service is an incredibly noble field for people to go into. So I want to get this out there in whatever way we can. So
No doubt. And this is a priority of the association. We're partnering with Adam on this. Please, if you feel like you need help, you want information, you need to talk to someone about how you handle these issues within your town, reach out to Adam. He gave you his email. We'll make that available as well. Check your Talk of the Towns magazine. You'll see an article in there with a QR code link. And again, the association is going to be working with Adam and others to bring you more programs on how to deal and strategies how to deal with this, because this is something we've identified as a problem for our members, their employees, and we definitely want to address this as we get deeper into this incivility issue.
Yes.
I can't fix social media.
no one can.
But we'll keep making sure we're here to support people. So thank you very much for taking the time to be here. Anything else that you need or would like to ever come back and talk about, let us know.
Thank you so much. I really appreciate it.
Thank you.